Hello, Dr. Robert Arnone, upper cervical specific doctor of chiropractic, coming to you from St. Louis, Missouri. I want to talk briefly about subluxation. We mentioned it before, and it's really an important term that needs to be understood. What a subluxation is when either of these upper two bones get locked in the wrong position and then put pressure on that brainstem, which sits right in that area here. That will interfere with the mental impulse up to the brain. It affects all the nerves to the body below, and really any number of different conditions or symptoms or problems can result from that. Take, for example, Superman, Christopher Reeves. He was someone who had fractured these two bones. Now, he didn't have neck pain after that. He actually had no function control. He was on machines. So it just goes to show you how when there's pressure here to that extreme or that extent, it shuts down function. So what happens is we find that people really all over, all walks of life, children and adults, very likely your children and yourself and your spouse and your parents are having this problem too, like Christopher Reeves did, just not to that extent. It's just being done slower. So in other words, like if you've ever seen like a brownout, like the lights dim, like in the city especially, you'd look at a brownout, not a blackout, but the lights dim. Well, that's kind of shutting down some of that, that energy, that light. Same kind of thing in the body. What that does, the subluxation will dim the lights. We don't want the lights dim, we want them full force. Okay? Now, the most common cause is birth. When the child starts to come out, the head comes out first typically, and there is using the head and neck as a lever to pull and twist to get the shoulder out, pull and twist to get the other shoulder out. And what happens then is the child is left with upper neck injury. Now, nobody checks this child to make sure that everything is okay in that area. They're going to check temperature, and they're going to check heartbeat, and they're going to check breathing, and they're going to look at reflexes, and they're all good tests to do. But the problem is nobody's looking at what's causing everything else to function properly or to function abnormally or improperly. So what I would tell you is, please get your children checked as soon as you can by an upper cervical specific doctor. Basically, you can contact me if you're anywhere in the Midwest region or St. Louis area. I'd be happy to check your children for you. If you're somewhere else, in other parts of the country or other parts of the world, you can still contact me, and I will try to find you somebody who has the proper training and that I can recommend to check your children. And you can contact me at drarnone@live.com. That's DRARNONE at live.com. Take care.